We are taking a closer look this morning at the illnesses going around this season. So acute respiratory illness is listed as high or very high in nearly half of the country, according to the CDC. Meanwhile, the outbreak of measles that is growing rapidly in Texas. And so joining us more now on how to stay healthy, of course, is ABC News medical correspondent Dr. Darien. All right, so Dr. Darien, it is still flu season.
Yes.
And we're learning that flu deaths actually surpassing COVID-19 deaths for the first time since the pandemic started.
For the first time since the pandemic started, and the numbers are exceptionally high. We're talking about some of the highest numbers we've seen in 15 years.
Wow.
And as I was saying during the break, if you come to the emergency room with me, you would very much see it. Many of my patients suffering from the symptoms of flu A. And test positivity is also high. 25% of tests returning back positive this year compared to 18% last year. And that contributes to that 33 million illnesses and close to 500,000 hospitalizations.
I'm remembering my grandpa telling me, you're going to catch a cold if you go outside when it's freezing out, right? And we've seen these like fluctuations in temperatures of the cold and now the warm up. Yeah. But does the weather really play any difference in making people sick?
You know, I think that's a great question. And my answer is yes, but not all of what we think is to be true. Our grandparents are right. When you go out cold, that does suppress your immune system, can make you more susceptible to infections. But really what it is that when it gets cold, we all move inside and we all share germs, and that increases our risk of exposure. The good news is that right now we're seeing signs of a relative peak, which we can remain hopeful for, but we have to remain cautious. The flu season extends until early spring, so you still have to protect yourself.
You still have to protect yourself. Okay, so let's talk about the measles in West Texas. We see that outbreak. Cases are spreading. What are the symptoms here? When do you actually see them?
Yeah, so measles is doing what it does best, spreading. It's the most contagious infection that exists. Just for context, one infected person can infect up to 18 other people who do not have immune protection.
Wow.
And vaccine rates are reasons why we should pay attention. They're steadily declining, and we have pockets of communities that are significantly under-vaccinated. Gaines County in Texas, 20% of children are not up to date on their MMR vaccine, measles, mumps, and rubella, which is one of the reasons why we're seeing an epicenter there right now. In close to 30 years, in Texas history, close to 30 years, some of the highest numbers he's ever seen in terms of measles. So symptoms to look out for. I've treated measles during our 2019 outbreak. Common symptoms include high fever, sometimes exceeding 104 degrees Fahrenheit, that textbook rash that can cover your whole body, cough, and sometimes conjunctivitis. It can start 1 to 3 weeks after exposure. And just remember, vaccines work. The MMR vaccine, which you get normally between 12 months and 15 months, is up to 95% effective in preventing. So these numbers are all preventable.
Okay, so two follow-ups on the vaccines. Do adults need the vaccines, and do we need to accelerate the vaccine series for young kids?
That's a great question. I think we just need to catch up. We need at least 95% of the population to be vaccinated in order to prevent outbreaks. Right now, we're steadily declining to 93%, but that number is not uniform across every state. As I said, you have pockets of significantly under-vaccinated communities. So do you need a booster? Most likely, no. The vaccine, thankfully, provides protection throughout your life. However, if you have immune compromise, or for example, if you're on chemotherapy, if you have other conditions, you can talk to your doctor about getting tested for a titer. But overall, you are safe. Your risk is relatively low if you are vaccinated.
Okay. Dr. Darien, as always, appreciate it.
Of course.